Mental health experts in the Ashanti region say they are seeing increasing anxiety disorders and depression, especially in young adults, linked to the fear of COVID-19, as Ghana continues to see a surge in cases. Now, they reveal that many of the young patients have conditions stemming from fear of contracting the virus and losing their livelihoods. Ohiming Teria of our health desk has more. Here's his report.
Meet 24-year-old Frida Ejay. She is among many young people whose social life has been affected by the fear of contracting COVID-19.
My name is Frida Ejay. I am 24 years old and I live in Kumasi. I'm a service personnel. Recently, there's this COVID-19 issue. It's very, very, very scary, especially for me. Even the name causes panic to me. It has affected my personal life, social life, and even work life, to the extent that I can't even sleep, I can't eat well.
Unlike many others who are seeking psychological care, Frida is not. She hopes to wake up one day to see COVID-19 disappear.
Right now, we are hoping for a cure. If there is a cure, we know that there is hope. If not, I don't really know what to do.
Ghana has, as of Thursday, June 4, 2020, recorded 8,885 COVID-19 positive cases with 38 deaths. Ashanti region has seen its cases rise in recent days to 1,452 with 17 deaths. Out of the number, about 1,000 of the infected are between 10 and 39 years. Doctors say the trend is inspiring fear, which is affecting the mental health of many young people like Frida.
When we recorded our first 2 cases, in fact, I was really scared. That day I didn't come to work. I was sleepless.
Those who do not already have mental health issues have started having mental health issues. Just the direct effect of the COVID. The majority of them come with anxiety issues.
At the specialist psychiatric unit of the Komfanoche Teaching Hospital, doctors say they are seeing more COVID-19 mental health related cases. Daily reported cases have shot up from 10 to about 30.
Those who already have diagnosis, most of them are relapsing, and for various reasons. Some of them are afraid to come to the hospital setting, to even come for their regular reviews, because they believe that the hospital is a front line. It's where the COVID cases are, it's where the virus is, and so they don't want to even come. They wait at home until they've run out of their medication. So our old clients are relapsing. Some are coming with comorbidities. Somebody that we were treating with depression will now come in with full-blown anxiety disorder. Some of them have had businesses breaking down, going down, and they begin to think. So somebody you were managing for maybe schizophrenia and then now comes in with depression. So our mental health issues have been on the rise, both old cases and especially new cases. We are getting a lot of new cases altogether in this pandemic era.
The surge in cases is placing a strain on the already overstretched facilities and staff. Dr. Owusu Antwi, who is also Vice President of the Psychiatric Association of Ghana, sums up the frustration of caregivers.
We are honestly overwhelmed. As mental health workers, we know our limits, and so we've put ourselves into teams. But when you come on duty, you realize that it's really overwhelming. If it has not tripled, maybe quadrupled, because we now even have to deal with not just patients who have tested positive and have suddenly become anxious. You have to deal with their relatives. You have to deal with the healthcare provider. So if one person tests positive for COVID, there are about 4 others who suddenly start developing anxiety symptoms that you have to tackle immediately before it progresses into something more severe. And so the parents, siblings, they live with the spouse, the healthcare provider that took care of the person, all have to be brought to be seen at a goal. So our numbers are probably even quadrupling.
At the regional level, the Mental Health Directorate says mental health cases, including generalized anxiety, has gone up. Depression, which did not show in the first 5 cases in 2019, now sits third in the psychiatric cases recorded in the first quarter of 2020.
If you look at the figures as compared to 2019, you can see that the cases are increasing. Because in 2019, from January to June, we had 5,180 cases. That is new cases of mental illness. Then in 2020, from January to April, we have 4,022 new cases. So you can see that we have 2 more months to end up with the half year. But if you compare the figure to the 2019 January to June, you can see that this figure is a bit higher.
Experts warn the number of COVID-19-related mental illness could quadruple in the coming months. The situation calls for immediate attention. From Kumasi, for Joy News, Oyime Ntewia reporting.